So this next question is for Joy, and then I'm going to ask you, Lisa, a similar question. So if a DoD or VA beneficiary would like to engage in therapy with a creative arts therapist, how would they begin that process? Would it be a consult from their primary care provider, or how would they access the services?
Yeah, so where I work, I'm embedded in a multidisciplinary, interdisciplinary health clinic where the primary, the person's doctor gives them a referral to enter that health clinic. And I work in conjunction with doctors and nurses and physical therapists, and we're really trying to work on this problem of the traumatic brain injury and post-traumatic stress, which is often has intermingled symptoms that are complex and challenging to work through. And so we have this great interdisciplinary care model. Other places that you can find creative arts therapists are in private practice. Some of them might take TRICARE. I know there's several in this area where there's private, you can find an art therapist in private practice. I would say also that being able to get that licensure, say, in the remaining states that we don't have it already, would support the ability of creative arts therapists in general, and art therapists in particular, to actually practice and be able to offer the services. And then I think the other side of that is that, you know, when we think about evidence-based services, evidence-based practice, we hear pretty consistently that our patients and clients, they love the arts, right? The arts are engaging. You know, who doesn't like listening to music, like, right? Or exploring, you know, what it is like to work with paint. You're a painter, right? Yeah. Yeah, so that is just gives us a boost of the positive emotions, and so if if you can't actually find a creative arts therapist, one of the places I recommend people to go to is the American Art Therapy Association's website. arttherapy.org has a art therapist locator, and you can see a map of all the art therapists. And I think that the other creative arts therapists also have such kind of locators, and you can, But you want to get people who are credentialed in the field, because it matters to have, I think the theme of this conference is like the right treatment at the right time in the right spot, or something to this effect. And so we want to have people who need credentialed mental health providers and rehab providers get that treatment. And then we want to be able to have these other community programs for people who don't need that level of care. And so that's really the trick. And then that would start with the primary care doctor, who would be able to determine that.